So I have Miss Cindy Golanka with me today. Cindy had platelet-rich plasma procedure performed in her cervical spine about 3 months ago, and today she comes back for a regular follow-up. And I will let Cindy describe her experience. I'll ask her a few questions, and I would like to know what she has to say about platelet-rich plasma procedure. So, Cindy, tell me, what was life like before you had PRP procedure in your cervical spine?
Before I had the PRP, I had tried everything that I could possibly dream of, and went doctor to doctor because the pain in my neck was obscene. It really was. And my migraines were so out of control. I've seen migraine specialists all over the state. I couldn't stand my daily life. I had no quality of life left. It was awful. The lights all had to be off in the house, and I would cover my eyes a lot and just listen to what was going around. I slept a lot. I couldn't stand to get out of the dark because even just a little light was extremely painful. I couldn't, I'm an artist and I couldn't make things anymore. It hurt to use my hands. I even tried to pick up knitting again. Nope, couldn't do that either. I always have kept my hands busy as an artist, and suddenly that wasn't happening anymore either.
So, what you're telling me is that life was miserable.
Yes.
Were you depressed?
Yes.
You were.
Yes, very much so. And the pain was obscene. I mean, it's the only way to put it. It was unfathomable that you could live like that. And, I have a great husband that would do anything and everything for me. I couldn't cut my own food, and I couldn't, carry a glass of anything.
I presume you had conventional treatment with oral pain medications, different types of steroid injections, physical therapy.
Exactly. Years of physical therapy, countless steroid injections. I don't even know how many I had. And I was just desperate because nothing was working. I was told that I needed spinal surgery, so I went to Duke, and Duke told me that with a disease that I carry, that I could not have this radical surgery, and he couldn't even promise it would work anyway. So I just thought, there's just nothing left for me. And then I met you.
So is that what finally triggered for you to come and see me?
Yes, because I just was going doctor to doctor. It's like, somebody help me. And I had had an opportunity to meet you before, and it stuck in my head. So I called on you again and said, help. And you listened to me.
Thank you.
It's amazing. I mean, you listen and you care about the outcome. You care about my quality of life. You care if I make art or not.
Thank you. Thank you. So once I explained you about the procedure, its risks and benefits, what were your concerns or fears about this PRP procedure?
I have had a lot of procedures in my life. And I was thinking, oh no, let's increase the pain for a while. And I just couldn't imagine increasing the pain. But then when I got to know you more, and we had some really good heart to heart, and I understood that this really was the last option I had. The laser did help here at your office. It did help, but it didn't get me out of the deep, dark world. It just made it a little more livable. But I couldn't live like that anymore.
Would you like to tell us about the procedure?
With my disease, I can't survive deep anesthesia. It was very light, but at the same time, I was relaxed. I trust you implicitly. I already knew that. But it's so professional, and everyone is so pleasant that any kind of nerves are just kind of smoothed out. I call it a well-oiled machine. You really have a great relationship with your staff. So you and your staff just work so effortlessly together.
That's good to hear.
And you were very concerned and very careful to make sure that any pain was cared for. Every once in a while, I felt a little twinge that ended quickly. Whatever you needed to do, you did.
So did you think that procedure was going to be more painful than what it actually was?
Absolutely. It wasn't so bad at all. And, the first day or two were not vacation. But at the same time, it wasn't so bad either. It wasn't really worse than I was already living in.
Mhm.
So it was really no big deal. I mean, and within a few days, I was already thinking, oh, wait a minute. So it was rather quick that I started receiving benefits.
So when you say it was rather quick, do you mean few days or few weeks or few months?
Days. I would say within a week, I was starting to think, oh, wow. And then it just, over the weeks, it just keeps getting better. And I'm doing more. I went out on a boat on Monday. I couldn't do that before. I can go outside with my dogs and I can go out in the garden. I caught myself helping my husband out in the yard, which that hasn't happened in a really long time.
So would you say 3 months after the procedure, are you back to your normal activities?
Well, it's been a really long time since I was able to do what I can do now. It's been years. Sure, yeah. I mean, I'm not 100% compared to other people, but I still have another underlying issue. But I'm doing much better than ever expected. I'm very happy. I can make art again. I can stay awake more. I don't have a driving migraine. I can make plans with people and not fear having to cancel. It had gotten to where I really didn't even have a social life anymore. So now, it's like we're doing things and going places.
How about your sleep at night, and how about your relationship with your significant other, with your children, with your family and friends?
Oh, everything's a lot better. I think I was no fun at all. I don't think I didn't want to be around me either, but now I'm finding myself again. I'm listening to books and enjoying the company of others and going out to dinner and go to my son's for dinner. And it's just been really nice. It's, I'm sure a lot of people assume I'm kind of a downer. I had someone see me the other day and she hadn't seen me in months and she went, wow, you look really good. I said, I am.
So, what would you tell someone who is planning to come for PRP procedure at Center for Pain Management?
Try to trust you. You know what you're doing and you really care and you want the best outcome and you look at every minute detail of care. You don't miss anything.
Well, I really appreciate you coming today and giving your message loudly to number of patients who are suffering with chronic pain.
It's my pleasure. Please.
Thank you so much.
I hope they do it because it's everything. It changed everything.
Thank you so much, Cindy.
Thank you.